The member for Melton.
Thank you, Acting Speaker, and I rise today to contribute to the Victorian Collaborative Centre for Mental Health and Wellbeing Bill 2021. And I know that the time is running out fast to the end of the day, so I'll cut my speech a bit shorter today and allow my friend and colleague to... No, I'm going to continue to go. I thought my colleague from Box Hill was going to finish after me. So anyway, I'd like to begin my contribution to thank the Minister for Mental Health for this important legislation that we are debating here today. And of course, thank his predecessor, the current Minister for Health. At the start of the Royal Commission into Mental Health that this government commissioned, the former Minister joined me and my constituents for a mental health forum out at Melton. Earlier on that same day, I had the pleasure of touring a facility with the Minister in Sunshine, and that cares for the supports of those that are in crisis and their mental health journey. And of course, these two events help solidify in my mind the importance of responding to the mental health crisis that exists in our community. My constituents in Melton who attended the forum were teachers, parents, healthcare professionals, emergency service workers and mental health sufferers. They shared the same message that came through loud and clear in the Mental Health Royal Commission's recommendations. They wanted their leaders and their government to take mental health seriously, and they were looking for their government to take action. They were looking for reform of a broken system. Over the last 21 months, Australia and Victoria have seen pressure on mental health as well as our health services as we battle this terrible pandemic. Our health workers and emergency services have done an amazing job, and many of these workers have been the first call or interaction for many people having mental health challenges. So too have our electorate officers, as they take phone calls, emails and of course dealing with social media interactions. And I noticed the Premier recently sent his thanks out to our electorate office staff. And I think all of us are appreciative of the work of our staff and all those healthcare workers, emergency service workers, and any volunteers that have assisted through this pandemic. It's been a terrible 20 months. I would like to extend my thanks to my electorate office staff, Diane, Greg and Nathan. They do a great job. Back in November 2019, the interim report of the Royal Commission into Mental Health was released, and recommendation 1 was the creation of this Victorian Collaborative Centre for Mental Health and Wellbeing to bring together expertise in lived experience, and that's important, research in clinical and non-clinical care, disseminating the practice of evidence-informed treatment, care and support across the state. Of course, the objective of this recommendation is to provide for world-leading translational research, workforce development and best practice mental health and wellbeing care. And it delivered in collaboration with people with lived experience of mental illness, of psychological distress. Of course, that lived experience is one of the most important things that we need to learn from. I want to pick up on a contribution from the Minister for Government Services and Creative Industries, and he referred to some teens in the US through iGen. And one of the things that stood out, these teens were obviously getting on with their life and accomplishing things in all factors of their life except with mental health. And one of the things that came out of some of the research over there in regard to these teens was poor sleep. They were on their devices during the course of the night. Look, I've been raising for years, fatigue is one of our major causes of mental injury. And I've seen it with paramedics when I was at the ambulance union. And what rectifies fatigue was good sleep or proper sleep or lengthy sleep. And I'm wondering whether during this pandemic that because people are fatigued that there has been an increase in mental injury. And that is why lived experience is so important and why we should listen to people and try and reduce our fatigue status of people. The Centre will integrate the participation of people with lived experience across all functions and governance levels. And this is so important. And the proximity of cutting-edge research with innovative service provision within the Collaborative Centre will ensure research priorities are set by mental health consumers, carers and practitioners, and ensure new knowledge is relevant and translated into practice. Acting Speaker, it's been nearly eight months since the Royal Commission final report was released during an historic joint sitting of Parliament up at the exhibition buildings. Since then, we are yet to receive any commitment from those opposite that they will implement all recommendations, just as we've committed to do from the moment we established the Royal Commission. On the 20th of May, the Andrews Labor government put our money where our mouth is, providing the single largest investment into mental health in Australian history, $3.8 billion to build a new mental health system from the ground up. It was a momentous day. Of course, those opposite shed crocodile tears for their mates in big business, who were being asked to put their hands in their pockets and contribute to one of the greatest social issues facing our community. They went on to voting against legislation to enshrine a mental health levy, as recommended by the Royal Commission. Of course, in their last term in 2010 to 2014, their entire spend on mental health was a measly $609 million. And of course, we invested $869 million just to reform the journey, and the journey set. Deputy Speaker, peak mental health bodies have also called on the Leader of the Opposition to commit to each and every one of the Royal Commission's recommendations immediately. We are not wasting a minute with getting on and implementing these monumental reforms. And today we are here to discuss one of the many reforms we have already got up off the ground, legislation to enshrine the Collaborative Centre for Mental Health Wellbeing in Victoria. The centre has 8 functions. It provides and promotes and coordinates the provision of mental health and wellbeing services. It provides the provision of specialist support services. It also promotes and coordinates interdisciplinary translational mental health and wellbeing research. It establishes links and service access pathways between mental health services and the centre by performing a coordination function for statewide services. This collaborative centre will collate and disseminate best practice advice and guidance to be applied across mental health and wellbeing settings. It will report to the Minister and Secretary on its functions, and these functions will help to complement wider reforms in the mental health sector and support the Government's commitment to implementing the recommendations of the Royal Commission in full. Look, during my career as a paramedic and representing paramedics, it taught me that our mental health system was in a desperate need of reform. And those suffering mental health issues often included my own union members as they struggled to deal with mental health trauma following horrific circumstances. We need to learn from our community's shared experiences. We need to make sure that mental health is given the same level of emergency response as those experiencing physical trauma. We need to understand someone suffering from mental health better. And I think at times we lack compassion in regard to that understanding towards someone that may have suffered a mental health injury. And I have an example of that. I represented a graduate paramedic who had sustained a serious mental health injury. In fact, he was suicidal at one stage. He returned to work from a work cover claim, but was not achieving his milestones and was about to be disciplined by a manager. I requested to the manager that due to his mental health injuries, that they should not discipline him. The manager said, but he has a clearance to return to work. And that was true. But of course, you can have a clearance to return to work from a mental injury. It doesn't mean to say that the mental injury is resolved. And in fact, as everyone here would know, people that have suffered mental injuries, they fluctuate on a daily basis of whether they're having good days, bad days, and any other type of day that they might have. Of course, in their wisdom, or in his wisdom, the manager still disciplined the graduate paramedic. Well, of course, what was the outcome of that? That set him back again on that negative pathway in regard to the flare-up of his mental injury. Look, we need to support our paramedics, our fireys, our police, our teachers, our nurses, our doctors, all our health professionals. We need to support the parents and family members. But most importantly, we need to support the sufferers, and we need to have a greater understanding of what they're going through and how we can support them even more. We need to hear those experiences and learn from them to develop the best response possible. Deputy Speaker, this legislation seeks to do that, and just that in addressing the Royal Commission's first recommendation, I support this bill and I commend this bill to the House.